Marburg virus. CDC warns U.S. public health officials of Ebola-like disease. Marburg virus disease, MVD, was reported in Tanzania and Equatorial Guinea. The U.S. Centers for Disease Control and Prevention, CDC, published a warning about the rare Ebola-like Marburg virus Thursday, advising American public health officials and doctors to be on the lookout. There are 2 confirmed outbreaks of Marburg virus disease, MVD, in Tanzania and Equatorial Guinea. The CDC says the pathogen likely spilled over from wild animals to humans. There have been no reported Marburg diagnoses in the U.S., but the CDC seeks to increase awareness of the risk of imported cases in the United States. The disease is usually spread through contact with infected blood or other bodily fluids rather than airborne transmission. Currently, the risk of MVD in the United States is low. However, clinicians should be aware of the potential for imported cases, the CDC said. The disease has epidemic potential, according to the World Health Organization (WHO). It has high fatality rates. Out of 8 Tanzanian cases reported so far, 5 of the patients died. Equatorial Guinea officials reported their first outbreak Feb. 13, where there have been 14 confirmed cases and 10 deaths. The Tanzanian government announced its first ever outbreak of MVD on March 21. Symptoms include headache, fatigue, sudden fever, unexplained bleeding and gastrointestinal symptoms. Muscle and joint pain and loss of appetite are also common. The incubation period is usually 2 to 21 days. The CDC noted that the disease is sometimes difficult to diagnose. Many of the signs and symptoms of MVD are similar to other infectious diseases, such as malaria or typhoid fever, or viral hemorrhagic fevers that may be endemic in the area, such as Lassa fever or Ebola, the CDC said. This is especially true if only a single case is involved. The CDC says the disease's mortality rate is anywhere from 23% to 90%. There is no Food and Drug Administration (FDA) approved vaccine for the disease, but fluid replacement and intensive supportive care in its early stages can be successful. Prior COVID infection provides just as much protection as vaccines, new study finds. People may be protected from COVID reinfection 9 months or more after testing positive, say researchers. A new study found that a previous COVID-19 infection offers at least the same level of protection as 2 doses of high-quality mRNA vaccines, such as Moderna and Pfizer-BioNTech. Additionally, people who are infected with the virus may be protected from reinfection for 40 weeks or longer, the study found. It was published in The Lancet on Feb. 16. Protection from reinfection was highest for the ancestral original strain of COVID-19 and the Alpha, Beta and Delta variants, remaining at more than 78% after 40 weeks. Protection was lower for the Omicron BA.1 variant, which dropped to 36.1% in that same time frame. When it comes to severe disease, hospitalization or death, protection was high across all variants, averaging 78% or higher for ancestral, Alpha, Beta, Delta and Omicron BA.1 at 40 weeks after infection. The level of protection declined over time for all variants, but it dipped fastest for the Omicron BA.1 variant. The study, titled, Past SARS-CoV-2 Infection Protection Against Reinfection, a systematic review and meta-analysis, was led by a group of researchers that make up the COVID-19 forecasting team. Dr. Mark Siegel, professor of medicine at NYU Langone Medical Center in New York City and a Fox News medical contributor, told Fox News Digital that immunity from prior infection, known as natural immunity, and immunity from vaccines both provide significant protection against severe illness and some protection, for at least a few months, against getting the virus again. This is the reason that I don't generally recommend the vaccine booster for at least a few months following infection, he said. Dr. Siegel said the strongest immunity is a combination of both, known as hybrid immunity, but he would never recommend that anyone get infected deliberately. It's too unpredictable in terms of disease outcome and the risk of long COVID, he said. The new study's findings could call into question vaccine requirement policies. This finding also has important implications for the design of policies that restrict access to travel or venues or require vaccination for workers, the study authors wrote. It supports the idea that those with a documented infection should be treated similarly to those who have been fully vaccinated with high-quality vaccines. This finding also has important implications for the design of policies that restrict access to travel or venues or require vaccination for workers, the study authors wrote. It supports the idea that those with a documented infection should be treated similarly to those who have been fully vaccinated with high-quality vaccines. Researchers analyzed a total of 65 studies across 19 countries. The studies compared people who had previously recovered from COVID-19 to those who had not been infected, through Sept. 31, 2022. When evaluating the infected cases, researchers considered the severity of symptoms, the variant of the virus, and how long it had been since people tested positive.